I think some are in KL, so half Malaysian. That's why Malaysia and Singapore, yeah, I cover both. So I'm going to share with you the advancements in stem cells research and GHKCU, right? Because I'm a medical doctor, so just like Dr. Su, in the beginning I do not believe so much. You know, when Jonas and Wendy came to me, I said, stem cell activation? Let me study more, right? Because for me, the mindset is not just Western medicine. For me, it's always Western plus any complementary approach that will help the patient. So, for me, I will learn more and find out more. So what are stem cells? You hear a lot of stem cells, right? For stem cells injection, it can be done in Malaysia, it can be done in Thailand, but it cannot be done in Singapore, right? Yet. So stem cells are the simplest unit of the living matter, the simplest cell. We all come from stem cells. Right? Let me show you why I say that we all come from stem cells. The stem cells, if you just read that, the stem cells serve as a sort of internal repair system. Anything that happens to our body, any injury that happens to our body, how does our body repair? It repairs by sending the stem cells there. Right? Sends the stem cells there, repair any injured area. So the stem cells has potential to become another type of cell. Right? Because you have bone cells, you have brain cells, but stem cells are not differentiated yet. So they can become any type of cells, right? With more specialized function, you will see, if you look at the middle stem cell, it can transform to bone cells. When you have a fracture, the stem cells goes to the fracture site, to the bones and heal it. For children, you see their stem cells activity is like 100%. For children, they heal very fast, they fall down, they injure themselves, they break their bones very quickly, they heal. But as we grow older, let's say we reach 30 years old, our stem cells comes down to about 25% the activity. When you reach 60 years old, your stem cells will be less than 5% activity. So that's why you see people who are older, when they injure themselves, when they fall down, when they break their bones, it takes a longer time for them to heal. Because their stem cells takes time and not so much stem cells left in their body in terms of the activity. But don't worry, we have a solution, right? So if you see blood cells, our blood cells comes from stem cells. Every 120 days, our blood cells will die, right? So the stem cells will start making more blood cells. So when you give your blood, or if you don't donate your blood, your blood cell, red blood cells will still die within 120 days. Nerve cells are very difficult to replicate or to heal. But stem cells can change to nerve cells. Epithelial cells, the surface of the cell. Immune cells, our immunity. We just went through the pandemic, COVID, right? During COVID, I did not have the patch. And Jonas told me, and Wendy told me about it, maybe at that time, I did not put the patch. So I should have put this patch here. Right? During COVID, I should have put glutathione patch here. Because the glutathione patch boosts my immunity. It will also prevent you from getting viral infections, and COVID is a virus. Sex cells, or muscle cells first, right? Injure a muscle, stem cells go there, repair. Fat cells, also, they go there. Sex cells, the woman's egg and the man's sperm, those come from stem cells. That's why I say we come from stem cells, right? All right. Professor Shinya Yamanaka, Japanese professor, he did the stem cell research and won a Nobel Prize. This was in 2012. Nobel Prize for finding stem cells that can change into pluripotent cells or reprogram the adult stem cells or cells into pluripotent cells. Pluri means many different types. So he can program the adult cells into many different types of cells. So that is regenerative medicine. So that is why now a lot of diseases that we need to heal, eventually you will find that it comes from stem cell healing, personalized medicine. So remember, Yamanaka, 2012, Nobel Prize winner, stem cells, regenerative cells. Okay, if you look at the past for stem cells, the past, the present, and the future, why is it? In the past, in 1980s, the scientists derived the stem cells from mouse embryo. Embryo is when the egg and the sperm comes together, you get an embryo, right? Previously, they get their stem cells from embryo. In the 90s, they managed to develop and derive the stem cells from human embryonic cells, the human embryo. Perhaps from people who abort their babies. Mid-2000, they found a way to reprogram adult stem cells. So you take fat cells, or you take liver cells, or you take bone cells, you reprogram it to become stem cells, and then use it. iPSC stands for induced pluripotent stem cells. That's what won Professor Yamanaka his Nobel Prize. So presently now what happens, different types of stem cells have been discovered, and now we have more uses for our stem cells. Right? We use stem cells for healing of our wounds, you cut yourself, or even operation. Right? Operation wound healing needs stem cells. Spinal cord injury. People who fall down, get spinal cord injury, that is very hard to heal. You see a lot of people paralyzed in bed, then the family members got to take care of them. It's very, very taxing, right? So there are stem cells now in research for healing. Healing osteoarthritis. Osteoarthritis is usually the knee, right? People have right? So that, a lot of people will have it. And they will try all kinds of things. Alright, so Malaysia, you're lucky, you can inject stem cells into the knee. But the effect is only about 30% useful. Or rather, 30% of people will find it useful, but 70% of people will find it not so good. It won't last that long. So, what people do previously, when they have the patches, they put 4 or 5 different patches on one knee. It helped them, but now you have X39. One patch, enough. You can even patch X39 here, right, for your pain spot. So this treats inflammatory conditions presently. For the future, what happens? Personalized medicine, as I said. Personalized to the person, personalized to the disease, personalized to the condition. So the ability to repair and replace damaged tissues and organs is what we're looking for in regenerative medicine. And potentially, we can cure neurological disease. As I said, nerve, when it gets cut, it's very, very hard to heal. So it can eventually heal and repair. I don't know whether 100% or not, but at least there is a potential to heal nerve problems. There are some ethical issues in stem cells. That is why certain countries still do not allow stem cells. In terms of stem cells, meaning injecting stem cells, right? So there are some ethical issues. Some people do cloning. So that's not very ethical yet, because they're going to take out your stem cells from the human being and they clone it. The accessibility, not that accessible. Why? Because for stem cells to be taken out of your body, to multiply the stem cells and then re-inject back into the body, not everybody can afford it. It costs $50,000 to $70,000 US for one session or one treatment cycle. But I guess, it helps. But have you got that $50,000, $70,000? I guess your leader here, I think he's 99 years old now, he would go to Switzerland and do that every year. It helps. It's good. All right? He comes back to Malaysia. He takes stem cells supplements, which cost about 1,000 Sing, which is about 3,500 ringgit per month. How many of us can afford it? If you compare to what LIFEWAVE can provide to the masses, that is a far cry in terms of scalability of helping more people, right? The cost. So that is why LIFEWAVE has this X factor. And you are helping people, right? I started not because I wanted to help myself. I started because I had many patients who say that they got a lot of issues and also they don't have that much money. So I wanted to help them. That's my initial intention, right? To help them and see how I can make a difference in your life. So the effectiveness of the current stem cell therapy, which is the injectable therapy, or you take oral stem cells, is not 100% effective. The results may not last forever, usually about 6 months, 9 months. Dr. Laurent Picard, you must remember this name, right? He is the scientist who found GHKCU. GHKCU is copper, right? So 50 years ago, in 1973, Dr. Laurent Picard placed liver cells from an 80-year-old man into a 20-year-old person's blood. And what he found, the 80-year-old liver cells became younger and became more healthy. So from there, 50 years ago, he found that GHKCU was causing older cells to behave like younger cells. So as I said, if I do not have clinical proof, if I do not have clinical trial data, I cannot stand up here to talk to you. Because I'm a medical doctor, that is very important. So the real power of GHKCU, G stands for, not much comes up. You want higher levels of GHKCU in your blood. And for that to happen, you need to have enough GHKCU, right? So looking at the amount of GHKCU, I think most of you have enough nutrition. If not, then how do you get GHKCU? We need a complete protein is 20 amino acids for a complete protein. 11 of those amino acids we can produce in our body. 9 we cannot. We have to get it from food, right? So we can produce the G in our body, but we have to eat the H and the K, the histidine and the lysine, and then copper. We have to get a little bit of copper, right? So for histidine, H, where do you get the H and the lysine, H and K? From the food, right? From meat, from eggs, from poultry, from fish. If you have that kind of diet, yes, you have the H and the K. Make sure you also have the copper, right? Copper is important. We don't need that much, but we need copper. And of course, you don't take copper and you eat, right? Where do you get copper? What type of food do you get copper? Besides taking supplements, of course, copper supplements. You can eat natural stuff, right? You can take chocolates, but make sure it's a dark chocolate, 70 to 80% cocoa. You can take oyster. You can eat lobster. You can eat liver. I don't like liver, except duck liver, pan fried. But that's where you can get your copper. Of course, a cheaper version of copper would be from green vegetables, green leafy vegetables, or nuts and some seeds, right? So copper is important. What does a GHK do in the body? GHK will snatch the copper and brings it into the cell. Because our cells need copper. Inside the cells, they need copper to produce a lot of other things, right? All the mechanisms, the stem cells, they need copper. Copper does not go into the cell. GHK catch the copper in the blood, brings it into the cell. That's why GHK-Cu is important. And what stimulates GHK-Cu? X39. So that is why X39 is what Dr. David Smith said is his best invention so far. Right? So the only two patches that is stem cell activation is X39 and X49. I won't be talking about X49. X49 is AHKCU, alanine. That is a sister patch for X39. There are only two X's inside, right? X39, X49. Right? So those are the activation patches. The other product that has GHK-Cu inside is which product?
I agree. I agree.
The Revive Eye Cream, right? That Revive Eye Cream has GHK-Cu inside. That is why when you put your Revive Eye Cream, you will decrease all the lines, the fine lines, and you look pretty and beautiful and handsome. Okay, GHK-Cu, what does it do? It resets genes to a younger, healthier state. Right? This is on the other side is the clinical paper, regenerative and protective actions of GHK-Cu peptide. Peptide means the three, you hear tripeptide, right? The three amino acids, G, the H, and the K. The three amino acids put together is called peptide or tripeptide in the light of the new gene data. So it tightens the loose skin, reverse thinning of the aged skin. You see old people, the skin is very loose and very thin. So how to make it thicker? X39. Repair protected skin barrier, improve skin firmness, elasticity, and clarity. You'll find that the skin becomes clearer. Even the facial skin becomes clearer. Right? After some people about 1 month, some people 2 months, but the rule of thumb, every 10 years you've got to use your patch for 1 month before you see extensive good results, right? So if you're 40 years old, probably 4 months later, then you'll see a very good result, right? If you're 60 years old, 6 months later. But clinical trials has also shown that you put X39 for 6 months, your age will reverse by 8.5 years, right? Is proven. So age reversal on top of anti-aging. Anti-aging means slow down aging. No product can reverse age so far, right? Except X39, 6 months, right? 6 months. So you reduce fine lines, depth of the wrinkles, improve the structure of the skin, the rough skin can become smoother skin, reduce photo damage, motile hyperpigmentation. When you go to the light, a lot of freckles, hyperpigmentation, it can reduce. You don't have to go for IPL, laser, that is very expensive. So this one will help reduce. Overall skin appearance better, stimulate wound healing. Wound healing is very important. protects the skin cells from ultraviolet radiation. What is the biggest organ in the body? Skin. So that's why X39 is very important, because it helps a lot on the skin, besides other things, right? Our skin makes up 15% of our body weight, approximately. And if you take up all your skin and put it on the floor, it's about 2 meters by 2 meters. 2 square meters. And that's about 15% of our body weight. That's the biggest organ of our body. And X39 is doing that goodness for your 2 meters by 2 meters and largest organ of this body. What else does it do? It reduces anti-aging effects at the cellular level, as I said. Produce anti-aging, it reduces pain. GHKCU goes and change the 7 pain genes, or rather activates the 7 pain genes in our body so that we don't feel that much pain. It reduces anxiety, it repairs DNA, promotes DNA repair, organ regeneration. If your organ is damaged, you go there, it regenerates, suppress fibrinogen, reduce tendency of blood clots. Now, number 1 killer besides cancer is heart attack, right? So you don't want that clot to form. The other one is stroke. You don't want the clot to form in the brain, you get stroke. You don't want the clot to form in the heart, you get heart attack, right? So X39 decreases the production of fibrinogen, which forms blood clots. It improves blood flow in tissues, reduces inflammation, because it reduces the interleukin 6, IL-6, in the blood. So it reduces inflammation. Recently, like 2-3 days ago, I read in Nature publication that IL-11, interleukin 11, if it's very high, it shows that we're aging very fast. So people are looking at how they can inject anti-interleukin 11, anti-IL-11 to slow down aging, right? That is injection, but still in the clinical stage, or rather animal stage. So we already have a patch. You are very lucky to be here. You're very lucky to be patching it. So remember, X39 saves a lot of people. Increase your skin growth, hair thickness, large hair follicles. Sometimes X49, 49 helps in hair growth, but not in everybody, or maybe to a certain extent. Different approaches to light therapy. Light is very important. We use light therapy to stimulate or activate the patch. In babies, you remember? Babies have jaundice, you put under the sunlight. In the hospital, you put under the light to break down the bilirubin. And all of us need vitamin D, right? We're always in aircon car, aircon house, aircon everything, aircon. We go out, we take the umbrella because it's so hot. But we need vitamin D, and the only way we can get vitamin D is when exposed to the sun. Not too much, because what I'm trying to say is the light is activating our body to produce vitamin D. The light from our body activates X39 for all the things that I just showed you that's happening in your body. David Smith, Dr. David Smith, best invention, X39. These are the clinical papers. As I said, these are important. If people ask you, is it proven? LIFEWAVE patches, like Dr. Su was saying, she's afraid that it's a scam. But he has more than 80 clinical trials. Clinical trials with double-blind placebo-controlled study. When you say double-blind controlled study, that's the gold standard in doing clinical trials. So he has more than 80 clinical trials to prove what he's saying and what we're using. Right? For us, doctors in the Western medicine, before we give anything, we need to have all the clinical trials before we can give, right? So same thing, he has done a lot of research. These are the clinical papers. So X39 increased the level of GHKCU in the body. Double-blind testing of LIFEWAVE X39 patch to determine the GHKCU production level in our body. Proven, as I showed you. If you look at just look at this last one, 0.03, yeah? At the bottom, 0.03. This is the p-value for statistical significance. Anything less than 0.03 means it's statistically significant, means it's good, means it's proven that using the patch for 7 days increased GHKCU in the blood. Okay? New approach to health. What does it do for X39? This is just a summary, yeah? Minor pain relief, inflammation control, improve your sleep. How does it improve your sleep? It goes through your GABA system, GABA, in the body. Mental clarity, yeah, I tried that actually. Because something called brain fog. Brain fog, you try, X39. Sometimes you need to put carnosine on top here. That one I read Jin Long's book. This picture out there has this carnosine right on top here, right? For mental clarity. In addition to X39. Supports wound healing, improves skin appearance. Okay, some pictures to show you. On the left side, after 1 year, improvement in the skin. After 4 months, and after 9 weeks. Right? At the bottom, you'll see after 3 years, after 3 months, and after 1 week. Some people with changes after 1 week are so lucky. Right? So lucky. Right? I've used it for 1 year. So along the way, people tell me, oh, you look younger. I say, Anyway, I think I feel good, so I continue using it and I continue sharing it, right? I'm not afraid to share it because of clinical trials that is being done. So there's proven clinically. These are some results in wound healing, if you can see. 13 months, maybe slightly more than a year, 7 weeks, 10 hours, 9 days, 20 days, and 2 hours. Right? As I say, the 2 hours one is really lucky. It works. Hair is more variable, okay? It depends on a lot of factors. I think genetic factors plays a great part, right? So hair growth is good. Some people have it, which is good, right? The man with the 6 months, he probably has alopecia areata, is a condition, right? When some people get no known cause so far, but some people when they're stressed, they'll get something like that. And I guess you do see friends who have that, right? So if they have that, you ask them to use X39. And after 2-3 months, you ask them to add X49. Right? So these two stem cell activating patches may help them. Where do we go from here? Right? What can we do to improve our quality of life and prime our body for the best health? And age reversal. So yeah, age reversal, X39, how many months? 6 months. Right? 8.5 years age reversal. You need a balanced diet, of course, nutritious diet, so that your GH and K and the copper is in your body already. At least 7 hours of sleep, your body repairs itself when you sleep. Right? So even if you patch, you need to sleep. Even Dr. Sue, she sleeps for 3 hours sometimes, but she still needs to sleep, right? Because she has so many things to do, but she still needs to sleep because her body needs that healing process. Supplement when necessary, resistance, train regularly, which is exercise, drink enough water and avoid too much alcohol, avoid smoking if you can, vaping worse, Don't vape if you can help it, right? And of course, drugs. Okay, that's the last of the slide.